Good morning, everyone. I'm Susan with Indiana SHIP, the State Health Insurance Assistance Program. Thank you for joining me for What to Know Wednesday. Today's topic is the do's and don'ts for Medicare agents. And at the end, I will answer your question about how to get them to stop calling you. But let's get started. Do feel free to chat in any questions that you have. Um, if you're watching this live, and even if you're watching it as a recorded Facebook Live or on our YouTube channel, my coworker Megan and I do check those messages frequently. So we'll be able to answer any question that you have. Okay. Now, just a word about Indiana SHIP. We are funded by the federal government, specifically the Administration for Community Living, and we are supported by the Indiana Department of Insurance. And we provide free and impartial information about Medicare and all of the related products. So we are kind of like your local Medicare office. What's an insurance agent? Well, that's somebody who sells insurance products. Many agents are just choose to sell one type of insurance or another, but a lot of agents sell the whole gamut: home, life, auto, um, health insurance. Some agents are even certified application counselors where they can help you look at the healthcare marketplace plans if you're not a Medicare beneficiary. But they are salespeople, and that's how they make their money. Nothing's wrong with making money, but we just want to make sure that people are aware of what agents can and cannot do. The Centers for Medicare and Medicaid Services, that's the big part of the federal government, does have some responsibility in establishing some rules around what folks can do about selling Medicare products. As you know, Medicare is federal insurance, national health insurance for folks 65 years old and older, and for people who have been on Social Security disability for a couple of years, or who have end-stage renal disease or Lou Gehrig's disease. So since it's really affiliated with the federal government, CMS does have some responsibilities. They see the oversee the healthcare compliance, and then they regulate how products are sold. Like the rule is the agents cannot make unsolicited direct contact with people. No cold calling, as you might have heard that phrased. Also, they can't just walk up to folks in common areas and try to sell them stuff. Some other marketing rules that CMS has is that agents have to wait until October 1st or later to start marketing the upcoming plans that are available to folks during open enrollment. Generally, these kinds of products are Part D drug plans or Medicare Advantage plans. So they can't start their hard sales until, pardon me, October 1st or after. They can't use statistics without documenting that information, and they have to get that information approved by CMS ahead of time. When they do public presentations, they cannot knowingly or wittingly provide incorrect information and mislead people who attend their events. They must avoid using the word free. Sometimes we hear this is free and that is free, but I think most of us by this point know that there's not a whole lot of stuff that's free in this life. And so sometimes when they say free, really they're talking about a zero monthly premium or a $0 something else. But that doesn't mean those things are free. And remember, they can't make direct contact with you unless you have given them permission to do so. They can't walk up to you, they can't cold call you, and so on. Here are some additional CMS rules. They cannot use symbols of Medicare, like the exact replica of a Medicare card in their print materials or they can't show you anything that has a Medicare card on it, because that kind of leads folks to believe that they are Medicare. They can't say that they are Medicare or with the federal government. They can't say that they're approved or endorsed or authorized by Medicare, or that they're calling you or contacting you on behalf of Medicare, or that Medicare told them that you might need a product. They may not go door to door. Now, in this day and age, there's not a whole lot of door to door sales. I mean, even the Girl Scouts hardly sell door to door cookies. But there are some people who still use this as a marketing tool. They go door to door, maybe they leave some information under your front door mat or stick it in your screen door. They are not allowed to do that. However, they can call you um, to discuss some changes in your plans, present other options, and they can also contact disenrolled beneficiaries for quality improvement purposes. They can also call you if you've given them permission. So, say you're at a senior health fair and there's a booth that an insurance agent or an insurance company has. And they have this fabulous looking door prize. You just have to give them your name, address, and telephone number. If you do that, you have given them permission to make that direct contact with you. So sometimes you have to decide, is the possibility of winning that door prize really worth giving a salesperson your information? They may not approach you, walking up to your door, walking up to your car, seeing you in the park or the grocery store. They cannot do that. Now, we do see at some large big box stores, insurance companies having an agent there in a little booth off to the side. That apparently is allowed, but they cannot walk up to you. So that's an important distinction. They can't go into a nursing home or an assisted living or another healthcare setting, including hospitals and doctors' areas. They cannot sell you stuff in those common areas. And that includes dialysis centers and drugstores. They cannot call you unsolicited, including under the guise of selling some fabulous Advantage plan or the best drug plan there is. Now, they may call you to confirm an appointment. Sometimes it takes more than one appointment. Sometimes with a SHIP counselor, it might take one more than one appointment for you to decide on your options. And they are allowed to call you to confirm an appointment. They can conduct sales activities in a common area of the healthcare settings. So it could be waiting rooms, cafeterias, rec rooms, conference rooms. And so sometimes the places allow folks to come in and sell their customers, clients, or patients products. They have to secure a documented scope of appointment. And this is a technical phrase, but this is something that outlines exactly what they're going to do with you or for you during your appointment time. This is something that I see that's fudged a little bit. They are not allowed to provide you a meal at one of their events. Now, I don't know about you, but during open enrollment, that's October 15th through December 7th each year, I see a lot of full-page advertisements in the paper, that say, come to this restaurant or that restaurant and hear about your Medicare choices, or hear about these wonderful low-cost, no-cost plans. Now, when you have a meeting at a restaurant, don't you kind of think that you're going to be served something to eat or drink, hoping it might be a lunch or a dinner? But they're not allowed to provide meals. They can provide light snacks and a beverage. They cannot market or sell at an educational event, including distributing their marketing materials, and even worse, enrollment forms. So when you go to those events at your local restaurant and a salesperson is telling you about all the products that they represent and how wonderful they are, they cannot sign you up at those events. Likewise, at health fairs and senior events, if there's an agent or an insurance company there with an agent, they are not allowed to sign you up or change your plan at those events. That's when you would make the appointment. And hopefully, in between those healthcare events and that appointment, you'll do a little research. And that may include meeting with a ship counselor. We have plenty of clients who meet with us and receive our information that's impartial and thorough. And then they use an agent or go to an agent and get their take. We have no problems doing that. The more information and the more education you can get around your choices, the better. Now, they are allowed to schedule appointments at these events and when they go into the common areas of healthcare settings. Remember, they can call you to confirm an appointment because that means that you've given them permission. You've already engaged with them, given them your phone number and said, yes, call me, here's an appointment, let's make it, and then you can call me for a reminder. And they can be in public waiting rooms. I remember one time in Southern Indiana, I was there to do a presentation about Medicare. And it was in a senior apartment community in their large gathering area. And there was all kinds of stuff, sales materials, brochures, business cards, prominently displayed in that common area. But that's allowed. They are not allowed to say they're from Medicare. Remember, boy, if somebody does that or says they're with the government, really shut the door, hang up the phone, walk away from that booth and that potential door prize because that's a really big red flag for them to misrepresent themselves like that. No door-to-door sales. Just shut the door. It's okay to be a little rude every now and then. And they're not allowed to cold call you. Now let's talk a little bit about some basic agent information, and we'll talk about the difference between an agent and a broker. Now, insurance agents are usually not contracted with all the companies. They can't sell from 50 insurance companies that they exist because they contract with insurance companies. Now, brokers generally represent several different insurance companies. But in both of these situations, I have yet to meet a broker or an agent who has access or is contracted with every insurance company that's here in Indiana that sells Medicare products, whether it's Advantage plans, drug plans, or supplement plans. So when they tell you about the cheapest price plan, it may not be your cheapest option. It's just the cheapest one that they contract with. Therefore, they're usually not completely impartial because they're only going to tell you about the plans that they sell and the companies that will pay them their money when they sell a plan. In the current situation, the Advantage plan sales are much more lucrative than selling Medigap plans. That could be why we see way more TV commercials about Advantage plans than Medigap plans. Advantage plan insurance agents can make hundreds and hundreds of dollars, where Medigap sales are much less than that. Agents are responsible for following all these rules. I know many people have confidence in their agent They love their agent. They feel their agent is doing the best for them. And I think most agents take their customers' interest to heart. They do the best for them. There's nothing wrong with using an agent. I do suggest that you get a complete picture of your choices from a ship counselor. But if you want to go back to your agent and use that information, then we have no problem with that. We just want people to understand all of their choices. And a good agent is going to know you. They're going to ask you about your personal preferences, your health conditions, what you can or cannot afford or comfortable affording. And they really, most of them do have your best interest at heart and can be a really good contact and source of information. But sometimes, like every other profession, one bad apple can spoil the whole bunch. And you do have to be careful. If agents are doing things like we've just talked about that they're not allowed to do, you might have your antenna go up and look for another agent or just stick with your ship counselor. If you feel that you were treated improperly or you observe these rules being broken by an agent, at the Indiana Department of Insurance, we have a Consumer Services Division, and you can file a complaint about a particular agent. You can do that by calling them, or you can do an online complaint at this email or at this website. If you have a complaint about an insurance company that is selling Medicare products, you can contact 800 Medicare or visit the website medicare.gov. Now, back into 2023, there were something that kind of beefed up the rules. And this was because there were all these TV commercials saying really incorrect, honestly, amazing things about what, generally speaking, Advantage plans could do for you. And it was very misleading information. Most of them used people that we all know to lend legitimacy to the message, but the message was just incorrect, misleading, and not legitimate. And so the federal government made some marketing rule changes. When you see these commercials or you read print advertising, they have to have this quote: "We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact medicare.gov to get information on all of your options." This disclaimer statement is required to be verbally spoken within the first minute of a sales call over the phone. It has to be electronically conveyed when communicating through email, an online chat, or other electronic communication. It has to be prominently displayed on their website, and it has to be included in all of their print marketing materials in 12-point font and on television advertisements. You know the saying, read the small print. Well, sometimes disclaimers like this were put in such tiny print, people couldn't read it, or they didn't see it, or they just didn't want to focus in and read it. But now the requirement is that it is in 12-point font. Some sales also have a recording requirement. So all sales calls with the beneficiaries for the entire call, including the enrollment process, which sometimes can be kind of long, they have to be recorded and retained in a HIPAA compliant manner for 10 years. This is for new clients and this is for returning clients. Now, Medicare supplement sales are not included in this. However, generally speaking, when you're working with an agent and you're buying a Medicare supplement plan, I hope they're talking to you about prescription drug coverage because, as we know, supplements don't include drug coverage. And therefore, this recall recording requirement does come into effect because they're talking about Part D. If you have a Zoom meeting with a marketer or an agent or a salesperson, those also need to be recorded. The only time that sessions don't have to be recorded is face-to-face marketing and sales. But if they do any follow-up calls with you or help you enroll over the phone, those do need to be recorded. If you have questions, if you have concerns, if you would like more information about your Medicare choices from an impartial source, then feel free to contact us at Indiana Ship. We have counseling sites all over the state. We've got about 400 counselors that can help you figure it out. And here's our telephone number and our website. Since you're watching us on Facebook Live, I hope you will tune in tomorrow. But this shows you what we're doing in the rest of April. We do have one more session coming up that is in 2 Mondays on the 20th, and it's talking about how to make your Advantage plan work for you. And Megan is going to tell us some helpful hints to do that. I'll give you a quick preview for May. We're going to be talking about preventive health coverage for women under Medicare, mental health coverage under Medicare, and Medicare's coverage of end-stage renal disease. So go ahead and mark those on your calendar. Here's June. And we've started a new series, a Lunch and Learn. So since it's lunch, we started at noon Eastern Time, and we take a topic. This is once a month. Tomorrow's Lunch and Learn at noon Eastern Time, we're going to talk about home health care. How does Medicare cover home health care, and what can you expect, and what are the limitations to Medicare's coverage of home health care? So that's right here on Facebook Live. So try to join us tomorrow at noon to know about your home health care options. That's it for today. I hope to see you tomorrow at noon. So when we talk about home health care, have a terrific day and thank you for joining us.